Welcome, everybody. It's Dr. Doug Pernikoff and my wonderful co-host, Cindy Vickers.
Thank you for saying that. It was wonderful.
I kept getting you confused with the other girl, but no, Cindy Vickers.
Oh, my God. Story of my life.
Well, she took off for a whole week. We don't know where she went, but we were going to ask her questions later. I think she's part of the CIA. I think
well,
she
and you know that
clandestine events.
I was not able to locate my headphones even.
Yeah,
1 week gone, and
they
wow.
were only 3 inches in front of her face. But
program for reentry. We need another service here.
Well, anyway, we're representing Dr. Doug's All Things Animal radio show. I forgot why we were here. And we've got a special guest today. And you know what? Veronica, I forgot to ask your last name.
Martin. Veronica Martin.
Veronica Martin. Can you say hi to the audience?
Hello. Good to be here.
Isn't she great?
Perky and young.
Yes, I know. No, that's too much information.
Okay.
Anyway, the whole point of this visit is to talk about the whole process of approaching an opportunity in veterinary medicine. You're a third-year student, or entering your third year at Washington State University in Pullman, Washington.
Yep, that's
correct. So the first obvious question is, what the heck are you doing here in St. Louis?
So my uncle is a veterinarian, Dr. Ray Geisman, and so I just came over here for the summer to do an internship with him, and all of my dad's family lives here, so just hanging out with them for the summer.
And you've been working every day at the clinic.
Yep.
So that's a key point, because pre-vet students nowadays, when they apply, it's so competitive, they really need to know what they're getting into. And most of the veterinary colleges demand that you have so many hours of exposure to some aspect of large animals, small animal, exotics, all that kind
Before
of stuff.
you even get into school?
You have to put in, so I don't even know how many hours it is.
Well, they recommend, for Washington State at least, that you have 200 hours with any animals. But for Mizzou, you have to have 100 plus hours with all the different sections of animals, like equine, exotic, and all that stuff. Not have to, but it's highly recommended that you have a lot of hours. So yeah,
and, and the point is you're competing, so you have to stand out. You have to make sure you get the minimum requirements, and then anything else you can do to make you look special is important. So you said all types of animals. That include those big football players, if you go out on dates with those guys? No. Okay, wait a minute. I'm getting a head shake from my
You're
co-host.
Wonderful.
She's back at 5 minutes. She's already mothering me again with my behavior. I just love it. So anyway, Veronica, this is really exciting. I really appreciate you coming to talk to us. And we're going to just throw some questions at you. Do you want to ask her anything in particular? Or you don't care?
Can I just, I'd like everyone in the audience to know how much preparation time I get before we do these shows. Yeah. Mine is down to somewhere between 30 and 60 seconds.
She's so good, though.
I am a big fan, because of just one vet school, of veterinary schools. And, I used to sell medical equipment, and the idea was, there used to be something, I don't think it exists anymore, called the SIPS Collaborative, and it was all about how you can reduce infection in OR. And generally in the hospital. Like, you've heard all these things about just hand washing for extended periods of times, but there's other things that get involved with that. So during that course of time, a lot of it was about keeping core temperatures up in
of your patient?
Yes, of the patient's body, especially during surgery. So that had to do with the medical equipment that I was selling. So our job was just to put it in hospitals. Well, some of the hospitals were very open, some not so much, but I had the opportunity then to visit the vet hospital. I thought, well, who knows, maybe they'll want it. I was so impressed with the vet hospital. I thought if people, and I'm not even going to say the hospitals I went to, but many hospitals in the surrounding area and even out in Columbia, I saw what I thought was more impeccable and forward-thinking care for the animals at the University of Columbia than I did in the hospitals for people. I mean, I was shocked. And plus the vets were really, really friendly and nice and, willing to talk to you and exchange information. So,
well, and I told, we were talking yesterday, because I was lucky to have Veronica was actually visiting with me at my clinic, and we were just discussing, but I say, and I've said this before, I think on the radio, that more people become veterinarians because of a true love for animals than do people become doctors for any particular love of humans. So I think that's true. I think veterinarians are a special breed. They're very empathetic and just love what they're doing.
Well, I do have a question. And Well, I know if you've been at Doug's hospital, that's really a really exciting one to be in, because you have no idea, even though it's largely a small animal practice, it could be a lion that comes today, or a baby chimp, or a scorpion,
we had a monkey
or
in today.
A one-legged, a monkey, one-legged swan. I mean, you just have no idea, and plus he's hilarious. And just give a shout out to you, because I have worked near Doug and other vets, quite a bit, and he is an exceptional
Can the
surgeon.
audience see me blushing?
Yes, he is
today?
a great surgeon.
Blushing.
It's very important that you're quick in surgery if you can be. Okay, so I think what you just said is that people who become veterinarians probably do it largely because of love of animals, and I want you to address that in a second. So what I wonder about is that when you get into the real day-to-day work and all the things that you have to do that kind of hurt them, because you can't help it, I mean, they have to give heartworm medication, or even, which is like sticking a spoon through their body, I think, and that's how it looks to me. Doug's just horrified that
What
I
are you
said that.
talking
Like,
about?
Yeah, that's how I describe it. They stick a spoon in their back, and it's just awful.
She grew up in a different home than I did.
But just even the things where they, if they have to get x-rays, or you're trying to take blood from a 4-week-old kitten's neck. I mean, there's just a lot of things that are just really difficult that need to be done medically. And I wonder if you look at that and go, I didn't really sign up for this. I really want to be like in a room full of puppies jumping around. And
I know that's why
help
my
them.
kids didn't go into veterinary medicine.
Yeah. So
So I
is
know.
there a shock value, or is there anything that made you go, oh?
She's not there yet.
Well,
Okay, but spending the time
Right,
in
right.
your vet office and with your uncle, you get to see this. This is what you thought it would be.
And definitely seeing like sick animals and the treatment and stuff is hard, and it was definitely an exposure to me that I'd never really been around. But I have had friends, that have been in pre-vet with me and have gone into a vet office and been like, why would I ever think about doing this, And I think that it's a different kind of perspective on it, and a different kind of love for animals. Like, okay, I'm doing this and I'm going to do this so that I can hopefully help them and hopefully help the owner and stuff. And it's all about perspective, at least for me, like with the experience I've had and everything.
And you've
so.
grown up, you told me you've grown up with tons of different animal exposure,
Yeah.
and your parents seem to support it.
Yeah, definitely.
Talk a little bit about that.
I always grew up having like 8 to 10 animals, of just mice to rabbits and cats and dogs and stuff. And I wouldn't say my dad exactly supported it, but my mom definitely brought home animals and stuff. And I was always exposed to taking care of them and the responsibility that it takes. And it's not always a pretty puppy, like you get sick
Yeah.
animals and you have to take care of them, and it's your responsibility. And so, yeah, I've always been exposed to it. And, I just think that it's a bigger picture, and
It's
not
fun
about-
I think it's fun to see young people that can really commit to something early. You don't have to. I mean, the world is full of opportunities, but if you find something that strikes your passion and you're willing to put the work into it and go for it, then you're going to really enjoy that practice.
So are you a good student, Veronica?
I would consider myself a good student, yes.
Oh, see, that's hard to say. She must be a really good
She
student.
comes from a very bright family. I'm actually good friends with her uncle, Dr. Ray Geisman, at the Hampton Avenue Vet Hospital, and he's an amazingly bright guy and very, very capable veterinarian. And I've taught him everything he knows.
So how much science? I mean, you're a doctor, and you're a surgeon, and then you're a GP, and then you're a dermatologist. I mean, I know there's specialties. Do you want to do a specialty, or do you want to be a...
I'm not exactly sure. I think that I do want to specialize in something, just so I can kind of find like my niche and go into that and everything. But who knows what's going to happen? I still have 6 more years of school. So.
Yeah. I mean, we're trained as generalists, and it's getting different now.
Yeah.
It's changing, and we have a lot more specialization, and the sophistication in our science we've talked about is really advancing with new technologies for diagnostics and therapeutics. So all that training drives people out of the general practice, and more general practitioners, aren't doing some of the most elaborate orthopedic cases or soft tissue cancer surgeries and stuff like that. So we're relying more and more on those specialists.
Yeah.
In Grey's Anatomy, they're all specialists, and they happen to be the best in their field, all of them.
In 50 Shades of Grey,
No.
they're very specialized.
No, Grey's Anatomy.
Oh, I'm so sorry. I got that one mixed up.
And they all just happen to be good looking, but maybe that's something.
Well, that's a funny thing you say.
Specialists are all good looking?
Wait a minute. No, I'm going to say this is a true story. But when I went into vet school, it was after Vietnam. It's been a long time, and there were a lot more men applying because they were looking for opportunities. And when I applied, there was like a 1 in 13 chance of getting in. And now they say that there's more schools available, more spaces in those schools, and it's like a 50-50 chance. And I think the average is, 70%, 80% are women. That are
Yeah,
going
there
into
are a lot
profession.
of girls. I mean, most of the people that I know that are in my pre-vet program are girls. And
I wish I could put the time clock back and go back because I would just love that setting.
You certainly would.
I would have lasted about a month.
I can confirm that. So, being a junior in college in pre-vet program, what do you have to take that makes it pre-vet as opposed to just you're in?
well, actually,
school?
the pre-vet program is basically you can have any undergrad major, but you have to have prerequisites to apply to vet schools. So, I mean, I'm an animal science major, and a lot of veterinary students are animal science major, and that's because it aligns with the prerequisites for the vet program. So, yeah, it's basically just the prereqs so that you can apply, but you can have any major. You could be a business major if you wanted to.
We talked about that too yesterday, that Veronica was telling me that she wondered whether she should go and get a BA in sciences or something like that, or a BS, and her counselor suggested for that very reason, go through animal science because you'll get earlier contact with animals. Now, they're not going to be exotic animals or dogs and cats, can be more cattle and stuff, but just the ability and the opportunity to handle and be around animals starts to open your eyes and teach you, and
Yep,
you can
definitely.
reapply those kind of skills to your new sciences.
Well, I would guess that the easiest thing to get is your small animal practice thing with the dogs and the cats. But I mean, if you have to go out and birth a calf,
Yeah, which is fun.
Yeah, I would think. Just like
Birth or burp? They're both fun.
Do you know that there is another doctor in town? She's not a veterinarian. She's an OBGYN, but she, I'm going to say her name is Dr. Knight. She's extraordinary. But the reason that she says that she even got involved in wanting to be an OBGYN is because they lived on essentially a farm, and her mom would like wake her up, and when the calf was going to be born or the little foal was going to be born, and she remembers going down like early in the morning and watching that and being so enamored with it that she was like, I'm doing this birth thing. But she did it with people.
Well, it's funny you say that because my son had an accident and he cut his face open, and we went to the emergency room, and we were waiting for the specialist to come and close the stitches, and finally this young guy comes in. He was a third-year resident, and my son said, well, have you been sewing up things like this? He said, oh yeah. He said, in fact, my dad was a veterinarian, and I started sewing up cows when I was a kid. And I go, wait a minute, that just doesn't sound right. That's my son.
I know. Where's
But he did
the
an all right
plastic
job.
surgeon?
That's right. He was a plastics guy. Well, this is really exciting. So you're at a point now, do you want, I know some programs like Missouri, you can actually apply after your second year and get in, and you skip 2 years of undergrad.
Yeah.
And I don't know if your program offers that or not.
Yeah, so it offers a 7-year program, and basically I would have applied last summer, and then you get in, and then you finish your undergrad, and a lot of so you don't actually get a bachelor's degree, you just go straight in, and so I wanted to get a bachelor's degree before I go into vet
That's
medicine.
good. Gives you more flexibility if you want to go on further.
Is that like getting your degree in history when you really want to be a professional football player?
I
Is it
don't
something
know.
like that?
I don't know. Usually a lawyer. You usually go to law school if you're a history major, right? Or philosophy.
Well, I just maybe was not being fair to athletes because I'm a big fan of athletes. But
I know you are an athlete.
Thank you.
So 30 vet schools in the U.S. are accredited, all 30 schools that exist. And I understand there's like 3,000 graduates a year, nationally. And then a lot of their other programs outside the U.S. that have worked out relationships with the U.S. Vet schools and colleges. And now, if you were not to get into vet school your first time, would you reapply, or would you be interested in looking at other foreign schools?
Well, I think that if I didn't get in the first time, I would just work for a year, save up money, and then I would probably apply only to
Stay in the U.S. system.
Yeah, I'd stay in the U.S. I don't know, I've just never really thought about going out of the U.S., but maybe if, the opportunity striked itself, I would, but hopefully I'll get in the first round.
Yeah, I think that whatever way you do it, it's when you come back and you get into practice and you start being the person you are. But I know kids that have done that. And one guy went to Scotland and just loved it, and now he's back in the U.S. Other people in Central America, there's some programs, or the Philippines used to be a big one. And it's interesting to look at the options you have.
So if you ideally would have experience with the different, I guess, species or genres of animals, and again, so you have your uncle, where you can get direct experience with small animal practice, and then what did you say you would do, which would be, animal science degree that you could likely get experience with, cows and horses. What do you do to get experience with exotics? Do you hang out with Doug? You have to come back to St. Louis?
I am the man for her to learn from, and we would take some time to teach her the exotic medicine.
Because who does that? But
not
you.
too many.
Well,
not too many.
You can shadow vet zoos, I think.
Yeah, it's a little harder, more competitive. But we're going to take a break here in just a second. We'll come back and we'll visit again. Cindy and I will be questioning, and you are a wonderful guest, and you are just having a good time so far, right?
Yeah.
Okay. So Veronica will be back right in just a second. Dr. Doug's All Things Animal radio show. Well, thank you for listening.
Hello, I'm Mr. Ed. A horse is a horse, of course, and no one can talk to a horse, of course. That is, of course, unless the horse
Well,
is
we're
the
back,
famous
kids, and we're here with Dr. Doug's All Things Animal radio show. My wonderful guest, Veronica Martin.
Yep.
And, of course, my great co-host and best friend, Cindy Vickers. And we were just talking about the veterinary college and the opportunities to get into vet school. So you're preparing, you have to do your vet application that requires some testing. Is that correct?
Yeah, so it's the GRE, I'm pretty sure, yeah. And then
Is there an option to do? We used to have like a vet-specific entry test. Does that not exist anymore?
No, I don't think that the vet-specific one does. I think that you can take the MCAT and it can go towards the
Transfer.
application, but I think that's specific to different schools. Some don't accept it for the GRE.
I think that's neat because if you decide...
Wait a minute. What? The
a
what?
graduate record exam.
Okay, thank you.
But it's very interesting because having that behind you, in the event that you wanted to do some graduate work, and this is another thing we talked about yesterday, but I really encourage all young vet students to go through, and if you have the stamina and the interest, to find a subspecialty that you can get a master's or start a PhD while you're in vet school, and then go on beyond the basic 4 years of veterinary college and do something. You can do a residency, an internship or a residency, PhD, master's. You can go into specialized training with the government or whatever. There's so many opportunities that they don't really tell you until you get there and you have to look into it yourself.
So, Dr. Pernikoff.
Yes, Ms. Vickers.
How difficult did you think vet school was? I mean, you have to be a GP, you have to be all those things. You have to,
Yes. I think everybody takes a different attitude about it. I found it really fun, and I think if you talk to some of my professors, they'd say, "Yeah, you figured it out." But I just did everything. I couldn't wait to get into vet school, and I remember the first year I walked around going, I'm really in vet school.
And where'd you go to school?
I went to the University of Missouri in Columbia, Missouri, and that's where I did my 4 years of my graduate work. And it was a lot of fun. And so it was fun for me. And I even, as an undergraduate, not only did I work in special areas like the birds of prey, there was a raptor rehabilitation program, and I took over as a young student and learned all about that and managed. But then I got to also get into the hospital earlier than my classmates. I learned how to do catheters and all that. And then I used to hang around the ICU because everybody was afraid of the intensive care unit because it was a hard part of your training. You can't mess up. So I would hang around there my first and second years when I wasn't supposed to be there and help and learn, and I developed more techniques so that by the time I got into clinics, the stuff that my classmates were freaking out about, for me, it was kind of fun, and I could get through and focus on the care.
So these are tips.
These are
Definitely
tips.
helpful
Tips for Veronica.
Yeah, it was fun. I couldn't get enough of it. So I just, I could be there. And when I ended up working at the Fort Worth Zoo, for instance, and I worked there. I was the first full-time vet, and I started the program, and I must have worked literally, the first year my family wasn't there, I worked 18 hours a day, and I couldn't get enough of it. It was so much fun. So and having talked to Veronica, I know she's got that same kind of spirit, which is really cool. And I think she's going to be the same kind of, I love this profession kind of vet, which is neat.
Even working in the clinic, and certainly I'm not a veterinarian, but I always felt that way too. It never felt like work. It was just like it was always Always.
Always.
Really, really fun to be there.
Maybe a little nutty.
Maybe, but it would be like a great way to spend your day.
It was, yeah. And I have to tell you, there's the first question. I speak to the pre-vet students at Mizzou. So every other year, they invite me to speak, and I talk to about 200 kids. The first thing I ask them, do you understand the cost associated with your education? Because there's undergrad, 2 to 4 years.
Yeah.
And you got to figure that's going to be at most colleges, in state even, $20,000 to $30,000 a year, I imagine. And then that doesn't include sometimes traveling back and forth to home and all kinds of stuff. And then you get into vet school. The average veterinary college in state costs somewhere around, I would say, $20,000 to $30,000 minimum, up to $50,000, and then in some schools it's up to $70,000 for out of state. So that's a hell of an investment. You got 4 years of that. That's another $200,000. And I learned when I was reading some of the statistics that the average veterinary student graduates with about $150,000 graduate debt. That doesn't include undergraduate. So, and your starting pay is going to be around 65 to 70. So those are real considerations. You know, I mean, when you think about it, is this really the direction I want to go? I'm going to be in hock for the rest of my life. So you got to either marry rich, work really hard and get the best job you can, or I don't know how people do it. You know what I mean? It's
Well, it seems like
it's a commitment.
work really hard is a key factor. Like you can't go, it's
Not
5
marrying
o'clock.
rich.
Yeah, I mean, you have to, once you can build, I mean, I watched, a couple of people build their practice. I don't want to mention names, but they worked really hard. And so, I mean, if you're ready to walk out the door and somebody walks in, you take them.
Yep.
Yeah.
And then, but what happened is people became faithful.
Yes.
And then, that first year, I think, is really challenging. And the second year is hard. But by the third year, things look much better if I think you also have to have, okay, let me ask you this. We know that you like animals. How do you feel about their owners?
So that's part of the reason that I have so far really liked working in the clinic and everything, is that I like working with people. Like, I've always just been drawn to people and helping their animals. You can tell that it's helping them.
Sure.
And having a companion, I think, is really important to a lot of people. And so if I can help their companion and help them be like mentally happy and everything, that's really cool to me. So
I think when at least for me, if I bring my pet into the vet hospital, I get people two things. I want to have some reason to believe that the person who's going to be working with either my child or my pet is highly competent. And then I also want them to be, I want them to explain to me what they're doing and talk to me like I'm a human being and look at me.
Yeah.
So, and I like them to use all the big words, and I will say if I don't understand the word. So you have to feel that person out and what they want to hear. But I think you really need to do both. And so you have that obligation to be as competent as you can be. But, people are worried.
yeah.
They're really worried. They're like, please don't hurt my puppy.
Yeah.
At the same time, you're missing one big point. I think you meant to say it, but she kind of expressed it. You've got to be able to communicate with the pet owners because they're like the parents of children. And you implied that. And that's so important because they want to know you care.
Yeah.
And you can be the most brilliant vet in the world, but if you have no bedside manner, you're not going to be able to sell your services, which is important. And, that's really, they need to know. I always approach veterinary medicine like I'm going to teach these people and talk to these people as though, and try and sell service that's legitimate based on things they're familiar with. If you go to the doctor, you know that you want your doctor to do all those things, be competent, communicate, be warm and kind of empathetic. And that's the same thing that these people want.
Yeah,
and
exactly.
maybe even more so because they know their pet can't speak to you. So it's almost like a pediatrician, they poop on you, they bite you, they pee on you.
Are you afraid? I mean, how much behavior training do you get in animal behavior? Does that
None.
really?
Well, I mean, it might have changed. I mean, I've been gone there a long time, but I think they should get behavioral training because I get a lot of questions on other shows, and it's always, I'd say 60% of the questions are behavioral. And then we've got, thank God we've got people like Cindy Vickers, who's a very professional trainer. at 314-761-8583. But anyway, but no, that's really important. If you can't read the pet or know how to go into a setting and be warm and kind of comfortable, the animal's going to respond negatively. So I have one quick story. When I started early, I was just helping some vet, and I went in, and it was an Akita, which is a big, beautiful dog. This is the biggest Akita I ever saw. And I sat down and I did a complete physical. Then I got up to get the shots, and as I got up and went around the table, the owner said, "This dog's a killer." And I go, "Killer?" I looked at the dog. I was just all over him. And I looked at him, and fear welled up within me. And that dog read that fear. Yeah. And he went like this. Grrr. I couldn't get near him after that. It was that dramatic. So your demeanor really makes a difference as you approach your patient.
So what are you afraid of? I mean, there has to be something you're like, I'm worried about.
Dr. Pernikoff.
No, yeah. Well, that's legitimate. That's totally legit. But there's got to be something that you might actually excel in, but right now you're thinking, thinking about what might happen, this is the scary part to me.
Well, anything in general or like behavioral with animals?
Or a specific animal.
I think the thing that worries me the most about it is just making a mistake. And like, I know that I'm not going to be perfect and that I will make mistakes, but that is something that I always want to try my best and be as good of a veterinarian as I can.
So you're really long-term. There's nothing that you're even afraid of, like in school? Because somebody's going to be watching you closely, I would think, while you're in school.
I had a class in animal science that was a horse training class, and so I got a baby foal and got to train at natural horsemanship. And horses are intimidating, and they can definitely pick up on how smart you are. And I did not grow up around horses. I knew nothing.
Was it like Monty Roberts? Who was that? Oh, you don't know? Okay.
Is that another person you
No,
dated?
he's a big deal trainer and that kind of natural horsemanship.
And I don't think horses are very smart.
Really?
I don't think so. I think you can really. In fact, I don't know a single veterinarian that's worked with horses that hasn't gotten hurt. And it's just like, if you're going to ride a motorcycle, you're going to get hurt.
Well, that doesn't mean that the horse isn't smart.
Yeah. Well, for me, it was
Maybe you're right.
I didn't know anything, and at first, I feel like the horse kind of thought I did, and then when it found out I didn't, because they pick up on things, like we learned that you teach it 3 times, and if they lick their lips, they're going to get it. And so then it was like, it found out that I didn't really know what I was doing, and then it would kind of be sassy with me, and it was a little intimidating because they can hurt you. So
I've had some very close encounters. I almost got myself killed by a horse.
With horse, you did horse behavior too?
I was doing massage therapy on a horse, and
don't tease me like that.
I literally, how I didn't die, I don't know.
We'll be back in just a moment with Dr. Doug's All Things Animal Radio Show. See you in just a second.
Well, listen to this. I am Mr. Ed.
Spin it! Let's begin it.
Well, here we're back with our third segment of Dr. Doug's All Things Animal Radio Show, and Cindy and I, Dr. Pernikoff, we're visiting with our special guest, Veronica Martin, who is a pre-veterinary student. She has some really mature perspectives, and I'm really impressed with who she is. Really.
Oh, thank you.
No, I'm serious.
I felt like you said that. Okay.
You thought I was enabling her?
Just as a
embellishing?
in direct opposition to the way you felt about me. She's really
Are we insecure today? This is terrible. Again, she's been gone a week. She think we replaced her already. But the other person we had here was like 80 years old and had to use an oxygen mask. So you're pretty safe, I think. Veronica, I just want to thank you. But why don't you, you're going to stay with us for the rest of the show. It's not too much longer. But would you tell us a little bit more about just what's in your heart and how you feel this challenge is going to be for you and anything you want to say?
Yeah, well, I'm super excited for the future. I mean, I obviously don't know what's going to happen, but I'm super excited about the concept of working with medicine and everything. And school has always been a huge part of my life and something that has always kind of driven me and everything. So, yeah, the idea of using knowledge and clues from people to figure out kind of a puzzle of how to deal with an animal and everything is super exciting, and I'm just happy to be here and learn more. So
Just keep your eyes and ears open, and when you get good mentors, try and pick their brains and ask good questions. And I could tell you're going to be an excellent veterinarian. You're going to represent the profession really in a great way.
thank you.
Try to work with a moose. I haven't found any moose.
What are you talking about? I'm telling you,
I'm
she was in Michigan. Did you see moose?
Yes, but I have a very good friend who happens to be in Alaska right now, and I want them to be on a really on high alert for a moose, and so that's on my brain. And I have personally never met anybody who has worked with a moose. So have you?
worked with
Of
a moose?
course I have.
Wait, seriously?
Are you serious?
I'm so.
Oh
my
my
God! It's changed my whole opinion.
I provide everything you would want in a man right here in one package. So yeah, go ahead and look for a moose. I don't know what that
All right,
means.
I'll keep
but
my eyes
if you
peeled.
can find one, it'd be
When
great.
come back, and when you're very famous and a moose expert, and we'd love to have you back.
What's the plural of moose? Meese?
Moose. I think
Mooses?
it's moose.
Moose.
Yeah,
I think it is just moose. Moose? I don't know.
Oh, now I got to look
we'll
it
have
up.
to look that
You
up. I'm
can't
pretty sure
take
it's
that.
moose.
I hate when I don't know.
Anyway, I wanted to bring up another topic because it's so critical. We brought it up. I think we talked a little bit about it in the recent past. But with these extreme weathers, we've got 100 degrees, over 100 all week, right? And no rain in sight. And, last night I was driving home. It was just at sunset, and I saw a lady sweating as she's walking down through the path, and she's got her dog. And I thought to myself, well, I understand that relationship's really important, but these dogs are carrying a heavy coat, and even those with a light coat, they still have more fur covering them than we have, and they ventilate through their tongue. They have to, that's why you see the dogs always with their tongues out. They don't have sweat glands except between their toes, so that's not going to help them. We really have to be cautious about heat exhaustion in these animals. It only takes minutes sometimes in extreme heat. And I've mentioned this before, and I'm going to take a question from my lovely co-host, but I was told that in 70 degrees weather in the car with the windows up is enough to cause heat exhaustion within 10 minutes in a dog or cat. And, God forbid we see this happen with children too. People just walk into the store thinking they'll just be a minute, and they jeopardize their children's well-being. But pets are even more, I think, vulnerable because people think, well, they can go out and run. If I'm running, they can run, and this and that. And I just tell people, if you're going to exercise, do it very early before the sun comes up and very late when the sun goes down, so you get at least some change in temperature.
So describe the symptoms and then what to do.
Okay, it's sort of like this. No, I mean...
Okay, wow. All right. I had my chance to leave earlier and I
You
didn't
asked.
do it.
So there's a lot of different... the extreme would be an animal that basically collapses and, they just go into like a heat shock. But more gradual would be that they start to slow down, they're hypersalivating, hyperventilating through their tongue, and they can start to look weak. You might even see them start to vomit or just get weak and they lay down. And again, their temperatures can rise to up to 107 or more, and that starts to kill the body very quickly.
So should you put cold compresses on them like immediately? And
yes, if you're going to go out and go around Creve Coeur Park or something like that, just be conscious of what you need to know where shade is. You need to have some supply of cool water. And in the worst case scenarios, you need to know that your vet or the emergency clinic is going to be available if you are after hours. You want to be able to call somebody and say, I think my dog's having a problem, and get to them right away. And they will put things like cold compresses, and they'll put them between the legs and under the armpits and anywhere where they're going to be able to cool down that peripheral temperature quickly. And some people use alcohol. Some people use drugs. They put an IV and start shooting fluids in there. There's a whole bunch of categories of care. But if you don't do it, the kidneys start to shut down. You get all kinds of tissue death. The tissue cells go into the kidneys and clog them up. You can have heart failure, lose consciousness. It's a true emergency, and I can't tell you how many animals I've dealt with in my professional life. And I just always wonder why people just don't think about it as much as they should.
Okay, so I have a last question that you hopefully can answer. What are your thoughts on shaving a a
very
long-haired
personal.
dog.
I think it is a good idea. And the one thing, you want to be careful not to shave them too much because they can actually get sunburn on their nose. There's certain breeds that are lighter skinned.
Most of them don't really have anything to shave on their nose, but it's just a small observation.
Yes, Mother, you're correct. She got me again. So, but I'm just letting people know solar dermatitis is a problem, can be all that, the ear tips, stuff like that. Or if, God forbid, you shave them too close, they can get sunburn anywhere and chafe skin, stuff like that. So,
But taking off that, you don't have to do it, but if you've got your collie or your golden retriever and you want to take that hair off for the summer, it could be just helpful for keeping them
I
comfortable.
think it's a good idea. Plus, it's easier to clean them and maintain them. So I think that's a really good idea. But again, prepare your run or your walk with the proper tools, and you need to have some water available, and preferably some cool water. And you just need to be watching your animal and look for abnormal changes.
And if you don't have a vet, we've got a number of a vet that we highly recommend here.
Oh, that's so very nice of you to ask.
781-8560, is that right?
No, that's not my number.
What is your
at
number?
all.
What is your number? I have to look at my phone.
Oh my God.
What is it?
I think that's the insane asylum.
No, it's very close.
It's 636-530-1808.
I think I just gave people your cell phone
I think
number.
that's some guy's number that you've been thinking about. But so yeah, I think you should carry information that's really important for your pet when you're out and about, and that includes the veterinarian's number, your regular veterinarian, and also your emergency contact opportunities, and be ready to react if you need to save your pup and or a kitty. Most of the time, the cats are pretty smart. When they're out, they know how to hide and get about and kind of protect themselves. But sometimes we push the dogs to go someplace they don't really need to be at the time. So that's a big concern. Have you ever seen any animals that have?
I haven't personally seen an animal that has gone into heat stroke or anything like that, but
Well, that's because you're from Washington.
Exactly. It doesn't
never
get
gets
that
below
hot.
70. You're so lucky. Any other questions did you have that we can talk about?
Well, so this
quick
is
thinker.
okay. We'll just go back to something else that we talked about, and this is just in keeping with what we've been saying. This is really not a good time to travel with your pet. If you are completely prepared in ways that you can, when you want to go in and have stop for lunch, you can't leave your dog in the car.
Right.
So if it's a long trip and you are not prepared, like you're not just sort of buying food and eating at the picnic table or you need, if there's not another person who can take the animals out of the car while you go into the store, that much time is too much time if you have heat that's 80, 90, certainly 100 degrees. So you have to really think about that. And I just was staying at a place en route to Michigan, and they lost their electricity. They had a storm and well, can you imagine if you had a dog with you?
I think that was just a ploy that your boyfriend pulled.
Well, it was like 70 degrees. It wasn't like terrible, but just things can happen. So I would just say this is really not the best time to travel with your pets unless you were extremely organized and have it planned out so the dogs were never left alone in the car even for 2 minutes.
Well, a lot of people do like to travel right before school starts again in August, so you're right, it's a big concern. The other concerns are that you always make sure you know where you're going to stay is going to allow for pets, and you make sure your animal has some kind of good identification, so God forbid if it gets away from you, you're not going to lose them, and that happens more than you'd ever imagine. So either some people tattoo, most people use a microchip of some sort, and that's recorded nationally and with your veterinarian.
Another spoon in their back, just so you know.
Between the moose and the spoon in your back, I'm still trying to figure those out.
Heartworm.
So anyway, that's where we're at, and we're gonna just say one more thing to Veronica.
Okay.
Thank you again.
Oh, thank you for having me.
Yes, thanks so much, and we wish you all the best in
Okay,
all your
thank
endeavors
you.
in vet school. And now, if you might not feel like you want to spend so much time in Dr. Doug's office, but if you're not scared away, I mean, again, you might have the, I mean, I had the opportunity to work with chimps, work with lions,
Yeah,
all
super
kinds of things
awesome.
just because of him. So
Yeah, it's super
That's fun.
exciting.
not too many people can say that.
Yeah, that's true. I still have people coming back, students or just clients that say, hey, I was at your place and 15 years ago and I saw a baby lion or something like that. It's good. Yeah, it was great.
Super cool.
Yeah, it's fun. So we're going to be back in just a moment more, and we'll finish with a recap of our day's visit. And it's Dr. Doug Pernikoff, Veronica Martin, and the other girl. Cindy Vickers, my wonderful co-host. We'll be back with Dr. Doug's All Things Animal radio show in just one moment.
All the trouble we get in with another tailspin. Spin it again.
He's a tramp, but they love him. Breaks a new heart every day. He's a tramp, they adore him, and I only hope he'll stay that way.
Well, welcome back one more time. This is Dr. Doug Pernikoff, Cindy Vickers, and our wonderful guest, Veronica Martin, who is a pre-vet student. She's been visiting with us and telling us about her anticipation and perspective towards her veterinary career. And a good friend of mine in the radio station asked me just a few minutes ago, have we talked about the business aspect of veterinary medicine? And the truth of the matter is, doctors and veterinarians and dentists are always considered horrible business people. And now, in most of the schools I know, they are actually incorporating business classes. Mm-hmm. And I don't know if you've heard anything about that or...
Yeah. So yeah, I think that they offer a few classes in the veterinary schools for business degrees, and I know that they kind of push it in undergrad to like just take some business classes. You don't have to get a minor, but just be familiar with the material because you have to use it no matter what.
Really, in this competitive arena now. So when I go to a veterinary conference, a national conference, I find myself more interested in sitting down all day at the business sessions, and they're one after the other. They talk about financing, they talk about human resources, how to manage a team, all these kind of things that are really key to a successful business besides, again, just being competent. Yeah, QuickBooks. Yeah. Cookbooks or QuickBooks? QuickBooks. Okay. So that's very interesting. And I think Cindy had a few things she was going to tell us about events this week.
Did you just make that up?
Oh, I did.
Yeah.
I'm sorry.
My take on the events this week is don't go. It's
too hot.
105 degrees. It's not a time to take your dog out. And especially if it was like an obedience competition outside, the dogs are not going to perform well.
They're not going to make it.
So we'll save that for next week, and we're going to hope for better weather.
Oh, that's great. It's great to have you here. And I just want to thank our audience. If you need some training support, you can contact Cindy Vickers at our clinic, 636-530-1808, which is the same number. You can contact me, the Clarkson Wilson Veterinary Clinic, and hope that you'll come back and visit us next week with our new guest. So thank you very much, and we'll talk to you soon.
Bye-bye.
He's a good one, and I wish that I could travel his way. Wish that I could travel his way. Wish that I could travel his way.